Boa tarde, é uma alegria estar aqui com vocês, apresentando a última mesa do dia, né. Tivemos um dia maravilhoso, muito proveitoso, eh, então agora para finalizar, nós temos uma mesa redonda sobre internacionalização da carreira em aconselhamento genético. Então é muito importante, cada vez mais presente nas nossas conversas, né. Hoje a gente vai ter 2 perspectivas que se complementam bem, a de uma profissional com uma trajetória já consolidada fora do nosso país, que é a professora Sônia Margarit, e a outra profissional que é uma brasileira, a Isabella Bucco, que que está vivenciando um processo de formação no exterior. Pelo fato da professora Sônia não falar o português, o resto dessa mesa vai ser em inglês. I will present both of our professionals right now, and we'll start with Professor Sônia Margaret. So first I present Professor Sônia Margaret. She holds a master's degree in genetic counseling from Lawrence College in Bronxville, USA, and a master's degree in psychology from the Pontifical Catholic University of Chile. She's a member of the genetics team in the Genetics and Genomics Center at the Clínica Alemana Universidade de Desarrollo. In 2022, she helped organize and is the director of the first online certificate in genetic counseling in Chile. She's a member of the board of directors and representative for South America at the Latin American Professional Society for Genetic Counseling, also known as FLAGEN. Our second professional for today is Isabella Bucco. She's a biologist from the Federal University of Paraná, or UFR, with experience in population genetics and research in Mennonite communities. She is currently pursuing a master's degree in genetic counseling at McGill University in Canada, and is also a member of FLAGEN as its co-director in marketing. So, Professor Sônia Margaret, please, you may start your presentation.
Okay, first of all, thank you. Thank you very much, Regina, and to all the organizers for inviting us. I am pleased to share with you the SPLAGEN, which is the Professional Society of Genetic Counseling in Latin America. Okay, so the title of the talk is Strengthening, unfortunately I can't speak Portuguese and my English is a little rusty, but I know Isabella can translate if you don't understand anything. So this is just to give you the perspective of what SPLAGEN is about. And we wish to strengthening genetic counseling in Latin America. So the next slide. Here. So we all know that this profession has been around for a while. It started in 1969 with the first graduate program in Sarah Lawrence, and it started mainly in prenatal and then in pediatrics, and with the years and with all the new discoveries, the profession has been diversified in different areas. And today we have specialists in areas of nephrology, cardiology. We have a lot of genetic counselors working in labs, in clinical laboratories, in research, and also in different settings, and not only in clinical practice. So we have all these different roles and areas. We don't only work in clinic, and most genetic counselors work today in cancer genetics, in prenatal, and in pediatrics. But we are we are specialized in different areas of medical specialties and also in different settings besides academia and hospitals and labs, and also in public policies. So in Latin America, the current status, if you can see here the map, we can see the countries where most of the master's programs are and globally. Most of the genetic counselors work in North America, Canada, South Africa. We have programs in Australia, India. There are programs that are developing in Asia. Also, and there are certificate courses in Chile, but we still don't know how those courses are actually, if they are certificate or have any type of regulations. And there is a gap in equitable access to these genetic service. In Mexico, we have one geneticist per 100,000 inhabitants. In Chile, we have one geneticist from 571,000, and in Brazil, one geneticist each 770,000 in the population. In Latin America, we know Cuba is the only one that has genetic counselors working as genetic counselors, and there is a master program, as you all know, in Sao Paulo with Georgina as the director. Only one in the whole entire country of Brazil, but there are no master programs in Mexico or other countries in Latin America. There are publications stating the global status of genetic counseling. These are just two. And recently there has been one publication regarding the programs, what recommendations are to develop in the programs. And I will talk a little bit more later about that. And the articles that were published by Abakan et al. And Kelly Orman, we can see that approximately we have up to today around 7,000 genetic counselors, with most of them concentrated in North America and in Europe. And in Latin America, as I said, it was, we only have some program in Cuba and in Brazil. In Chile, where I work, the medical genetics has been recognized since 1997. We don't have any master's program in genetic counselor. There are 2 clinical genetics fellowship programs in La Universidad de Chile and also in the Catholic University. Since 2021, the most recent one. And in all Chile, we have around 56 registered clinical geneticists, but actually only 43 are active, and most of them are concentrated in the metropolitan area, leaving the north area of Chile and the south with no geneticists. And there's only one genetic counselor speaking here that has a formal training as a genetic counselor with the master degree. Most of the professionals that work providing genetic counseling are the medical geneticists, and there are also healthcare professionals like nurses, midwives that have taken courses or certificate courses mainly in cancer genetics. So all other areas like cardiology, reproductive medicine, prenatal, there's no genetic counselor. They're only provided if it is by the medical specialists. And we all know that there are several challenges for integrating genetic counselor into the healthcare system. We don't have any academic equivalent. We have lack of training. There's a lack of recognition of the professional as healthcare providers. Belief that genetic counselor should only be provided by medical physicians, and it's not valued and it's not considered like a health priority in the healthcare system. Also, as most of South America, there is very few resources to cover these genetic testing and genetic counseling. In Chile, there's a very big disparity between those that can afford private healthcare insurance. So those are the patients that can pay for these services out of pocket. And but most of our population in Chile, at least 80% of the population, has the public healthcare system, which is called FONASA. And we don't have any clinical guidelines or regulation for the practice of genetic counseling in Latin America, and limited integration of genetic counselors if we have into the multidisciplinary healthcare teams. So what we have done, and actually these were the genetic counselor, Latin genetic counselors in the United States that started the conversations that in 2020, that there was a lack of networkers and professionals, and these genetic counselors that saw patients in the United States said that they didn't have any read of networks to connect the families to that live in South America. So they started questioning how can we access the people and the geneticists that see these families, and so they did a needs survey to understand the priorities of the field. And what they found out that they didn't have most of the there's no professionals. There was hardly, they needed some more interconnections, more development, more training, research, regulations. So all those challenges that I mentioned. So they created the society because of this, the community responses, and because previous of that, there was no organization that was dedicated exclusively to genetic counseling. We do know that we have RELAC, but it mainly focuses on medical genetics. And to lay the foundation, the society that is dedicated to connecting, to supporting, to raising awareness of the practice of genetic counseling. And if you want to find out more about the history of how the society was created, you can go with the QR to see the published papers in Genetics Medicine Open. There we have the mission as a society. The society's mission is to promote knowledge and access to genetic counseling service in Latin America by fostering education, professional support, research, and public policy. And our vision is to empower our members to integrate genetic counseling into all aspects of healthcare in Latin America. They develop the statutes and regulations, the descriptions of all the functions, and we actually have a website of the society in Spanish and English and Portuguese. This is the actual board of directors and the chairs. As you can see, there are many members can become part of the directory. Only there is a requirement that you have to be a certified genetic counselor, but members can have all the facilities and the benefits of being part of the society. There are actually 330 members with different members categories. We even accept students and any healthcare professional that is involved with genetics and provides genetics counseling. There are committees that are focused on public policies, member participation, communication, research, and ethics and educations. And there are specific projects that the society has achieved. This is one of the first ones, that was to create a registry of genetics, of healthcare professionals that provide genetics services and genetic counseling. And this was a project that was granted by the Society of Genetic Counselors from Texas. Another project was creating resources for patients and families to centralize all these resources. So if you have somebody with a specific genetic syndrome, you can find these resources in the language that the patient speaks. And also, this was created by Isabella and Laura Redondo about having, all these resources on our website, and these are free and accessible. And the Committee of Education provides websites. These are some of the websites that started last year. to create a more approachable way that you can find out of different aspects about genetic counseling. And this was the last president was Diana Bucco. And the last project that we developed was a proposed curriculum, and this was developed in September. It's accessible. You can go to the QR and see the curriculum, the program, which includes the minimum standards for the recognition of the professional training of genetic counselors, and it also allows for local adaptation according to the regulations. And our next steps is to continue to get grants to support educational projects, research efforts, continue creating patient-centered resources, and also to be able to create more collaboration with professionals across all professional specialties, medical organizations, a community of outreach opportunities. So I will encourage everyone to collaborate with us and to please send us an email. That's the email, and you can visit the website also. So, muito obrigada. I don't know if you have any questions. We have Isabella. Thank you. Okay.
Thank you, Sônia, for saying that. And I think what I'm going to say will link a lot with Splahen and Splahen work. My idea here is to share a little bit of my journey, why I decided to study genetic counseling in North America and in Canada, on my path, what I need to do to be here today, and share a little bit of perspective. And a big part of the reason why I'm here is because of Splahen and with the connections and networking I made with the society. So back in 2021, so the society was still beginning in the start. I contacted the society. I find a way to be an intern and help the way I could with the marketing. And that opened so many doors, and to learn what genetic counseling really is, because it's a total different reality from what we see in Latin America, and that what we can do for the patients in Latin America and what is being done in United States and Canada. And that opened a whole new reality to me and made me take the decision to, okay, I want to learn there. I want to learn with the professionals that are practicing for this many years with this profession that is well established. There are these guidelines, there are accreditations, there are this genetic testing, a lot of genetic testing for people, and how we can better support the patients and translate that to the reality we see in Latin America. And I think I will begin by saying why I choose Canada. I think that Canada has a reality that we can most translate to a reality in Brazil and Latin America with public healthcare system. So here in Canada, we also have a public funded healthcare. Genetic counseling, genetic testing here is funded. And I thought that learning the framework here would help me apply back home, be more translatable. And I was very lucky to have an opportunity to study here. So in Canada, we have 5 programs of genetic counseling. In the States, we have way more. I believe we have more than 50 programs nowadays. And they accept 5 students a year.
Yeah, there are 2 programs that accept more, but most of the programs accept around 6, 7, 10, but Sarah Lawrence programs accepts like 25, 28, and Northwestern is a big program also in Illinois and Chicago. So they accept around 28, 29. So those, but for South America standards, these are small programs. These are small programs.
They are, and here in Canada as well. I think we have 20 students per year in genetic counseling.
Yeah. And those students are first and second years together, right? Or
no,
those are per year?
Every year we have
every year. Oh, per year. Okay.
Students, yeah.
Okay. And so, well, I've been trying since I've been working in Chile for more than 20 years, trying to get set up a program, because we do have a certificate course, which is not the same. And I think students feel it's short. It's not, it's a basic, it just gives them the basic training, but it's not enough. And they are asking for more. Unfortunately, for some of the universities to have just few students in a program, it's not profitable for the university. So there has to be a way of developing a program with inter-university collaborations between different universities that will be willing to provide the courses, the professors, and that's the idea of mainly, and also the medical geneticists willing to supervise the first graduates that start their clinical training. So there's a lot of conversation, because everybody says that we need genetic counselors with the masters, with the more training and postgraduate training, and not just a continuing education course. It's not enough, because my impression is that they only provide genetic counseling for genetic testing, and genetic counseling is much more than genetic, just to educate about genetic testing and providing results and options for genetic testing. So I think I convinced with all the presentations a lot of professionals. Now I need to get on board the administration that they are convinced to do this, that it's feasible and we can provide and build up a master's degrees. And I hopefully in Brazil next year they will start doing a program, since we developed the curriculum.
Yes, and it's hard to find also these professionals to train the new workforce and start building the profession.
Yeah, we are thinking about options, like maybe providing the subjects, like what you can learn online. So the courses of genetic counseling we don't have, but medical genetics, we know there should be some medical genetics specialized in teaching those in the countries where the programs will be developed. But what we are more concerned is the practice, the clinical practice. That's the second year is mainly clinical practice and their theses, their research. So they need tutors for that and supervise. And I think in the United States, the first graduates from Sarah Lawrence, they started with the medical geneticists being supervised by them. And slowly these graduates will be the supervisors of the new students. So that's the idea.
Hello. So we have a couple of questions here. We're going to just ask Isabella to tell us a little bit more of your journey there in Canada. We're all a bit curious. There are a few questions about that in our private chat here.
Sure. So the application process for both Canada and United States is very similar and use the same platform, but it's very, very different from what we are using in Brazil, because entering a master program in Brazil is linked to doing an exam, right? A test, and have a good grade in that test. And here there's a lot more. The process is demanding. So they expect you to, you don't need to have a specific graduation title. So it doesn't matter if you have art bachelor or biology or psychology, but important is that the core subjects that you studied and have a good grade, but they ask a lot of complementary experience. So they want you to already have an experience counseling people. It doesn't need to be in genetic counseling, can be in other settings. They value if you have experience with genetic counseling somehow, which is very hard in Brazil. As I was not able to find any genetic counselor to talk with me or to follow their work, but I did that with some geneticists. What else? They require a lot of essays. They ask essays from your professors to recommend you. So it's a very different process to get used. When you get used, it's okay. But it took me some time, and it was not in my first try that I got in. So if anyone wants to talk more about the process, I'm available, and you can talk with the committee and ask for my contact. I'm very glad to help and walk through that part with you, because it's hard to be alone in that. And once you have all the application, then there are the interviews, and they are very, very demanding as well. Sometimes there are interviews that are the whole day, but usually I think they are 4 hours interviews, and with panels of different people. It's very stressful, but once you get the results and you are in. It took me 2 tries to get here. I think another barrier for us in Latin America, and the biggest one, is price, because here graduate education is paid both in Canada and in the United States, different from the USP program, where you receive a scholarship. Here, scholarships are very rare because genetic counseling is not a research program. So usually when you see scholarships for in the United States or here, you see it linked to research or thesis. And as a professional program, is rare to find those. I think recently we had in the States one big scholarship that I applied to. That is a full scholarship. I was able to manage and get a scholarship here in Canada from other foundations, so that's also possible. And you just need to look very hard. It's not easy, but there are some. And
what kind of subjects do you have like during your master's there? And like, do you have internships during your time there? How does it work?
My program I think is very different from other programs that I see in Canada and the States. Of course, we have classes, but it's not a focus. We don't have a lot of classes, and like since our first month. Yeah, thank you. We are in practice, so we are with our supervisors. We are taking family history. We are taking doing the pedigree, and I think that was my objective. I want to learn from people that are practicing, learning, doing. That's how I do, and it's demanding, of course, but it's also very, very, very enjoyable in the end. And how the program is structured here. So I have rotations in the different areas, and that happens in the most programs. So we have core rotations in cancer, in prenatal, pediatrics, adult. I think there are the core rotations.
And you do lab rotation or no?
Sometimes, then it's not mandatory, but you can choose a lab rotation.
Do you work with only like attending to people, or do you have like analysis training for like specific variants and stuff like that? Like that's pathogenic, that's likely pathogenic and stuff like that.
We have courses. It's not a main focus. So our focus, of course, is to interpret the results and know how to check, use resources, databases, not the actual work of a lab GC. Usually that when you want to be a lab GC, you look for additional information, or you learn in work. That's or you look for that experience in your training. Is not a core subject in our training. Our training is more clinical.
Yeah, there are programs that are more into doing GCs in lab, like the Baylor program. More of the genetic counselors that graduate, they are dedicated more into the lab if you are willing to. So, and there are some programs in the States that is more humanities, so it's more clinical. So you analyze which program is best for you. So most of the people that most of the
thing
people
about having more than one program, yes.
Right. Yeah, they have 60, I think, today, 60 programs around. And they are small, but it depends on what you're looking for and what your experience is, because most of the people come from biology, from lab research that apply to these programs. And but also, as Isabella said, they come from humanities, they come from art, they come from photography, but they have to take all the courses requirements to apply. And as Isabella said, it's very hard to get into these programs. Some people spend 3 years to get into a program in genetic counseling. They have tutorials to see how you can do the interviews. So they are specifically looking for applicants that have certain kind of personalities to do, the genetic counseling, which is more of empathic. So if you have done voluntary work in counseling camps, rape crisis, suicide hotline crisis, they expect that you have some experience in counseling, and also if you don't have any of the biology, they will make you take all those courses, because we are surprised when I tell them, oh no, in the States you don't need an undergrad in biology or nursing or medical sciences. And they are like, what? And they say, yeah, because they make you take all the requirements before you apply. So they tell you, okay, this is your background, this is what you study, you need to take all these courses. So you can spend 3 more years taking the courses to apply to the graduate program.
And here in Brazil is very different, right? So I remember when I found that genetic counseling existed, because here's not exactly a topic that many people know about. Usually when I tell people that I'm doing a master's in genetic counseling, they're like, what is that? Like, are you counseling the genes? That is a joke I heard many times already. So I remember I heard about it when I went to the conference in Rio that had about the Human Genome Conference.
Yes.
There's where I heard about it in more detail. I heard about it a bit. So when I came here to do the test, we had a test and then a small interview, very short interview, nothing like a whole day, like 30-minute interview, just to make sure we kind of could maintain ourselves here in Sao Paulo, because it is an expensive city. And it was a test. And usually, since it's not well known, genetic counseling here, we usually have spots left over. I think this year we had a lot more students enter. I think we have 6 new students this last test, which was like the biggest amount we had so far. Nothing compares, like even 20 students would be a lot already. Here in Brazil, we have very few students in comparison. Like in my year, we had 3, counting with me. And we also have some internships, but we don't have a lot of internships available, so we have to make do with what doctors are willing to receive us. And we do have some classes in training on variant analysis. Like I took some because I'm interested in the area. but like not directly inserted in our course. Like we have some part of some of our subjects touch on the subject, but nothing directly focused on that as well. We have a couple questions about directly for Professor Margaret about what do you think is the future of Splahen and genetic counseling in Latin America in general?
Well, Splahen is growing. You know, we have 330 members already. So, and we started just in 2021. So I think there are a lot of healthcare professionals that are interested in the area and want to collaborate with Splahen. I think the projects, the collaboration with projects, and also students that are willing to collaborate with Splahen, like Isabella, that can open a door if they want to get, they are willing to do, you know, a graduate program, or they have a project that are willing to collaborate in the United States. They are the ones that have all the connections in the States, and we are the ones that have the connections in South America. So I think the society will be growing, and we do have some spaces available for some committees, some for the ethical committees, for marketing committees, for the education committees. So we always welcome new people. The society is free to be a member. We're trying to see if we can, you know, charge a small fee just for, you know, to sustain it in a way, but it's not the main goal. We want, our goal is to collaborate and to keep, you know, the professional like it should be, because today what we're seeing that any healthcare professional takes a course, an online course, and say, oh, I'm a genetic counselor. Oh, I do the genetic counseling. And there's no title protection and no accreditations, no regulations. And that's what we're looking forward to collaborate with also.
There's a second question that I think kind of fits in there. It's a two-part question, actually. Do you think it's possible for a genetic counselor trained in South America, like having a master's somewhere here, to apply for certification from the American Board of Genetic Counseling, or even to somehow establish a similar certification board within South America?
Yes, I do think so. I don't know when and how, but it has to happen, because we need to have like a South American board certification to be recognized internationally, the genetic counselors that will be working in South America. And remember that this certification is just not once. You have to be recertified every once in a while. Or in the United States, it's every 5 years, because in genetics, things change. And always you have to be updated. You just can't stay what you learn, because there's always new things. And now we know with genomics, there's all these omics that are starting. We know the human genome, but it's going to be the epigenome. It's going to be, you know, the metabolic, all these other things that people are going to be asking, and more treatments and therapies are going to happen. So you need to be recertified. To keep certification and regulation, you need to be certified every 5 years. In the United States, you also have licensures, like every state, yes, not all of them, but to practice in that state, you need to get a license besides the certification. So it's very strict and controlled, those that provide genetic counseling. And it's by law in the state that to provide genetic testing and genetic and results, you have to have a genetic counselor. Doctor cannot work without genetic counselors in the public hospitals. So over here, some doctors do it. They don't have, because we don't have any program yet. But there has to be a way that we need to create these programs that have to be accredited and regulated, and have a certification that is recognized internationally, that those people that graduate from these programs will be able to work. And those are the ones that have the title of genetic counselors.
I understand. There's something of a controversial question that people ask in our private organizer chat. That is, how do you both, which of you from Canada and USA, see the acceptance of patients getting a genetic counseling session from a Latin woman, thinking about the political climate currently over there?
In the States?
In the States, in Canada.
The genetic counselors that are Latin, that are Hispanic?
Yeah, from a Latin woman.
Mm-hmm. Well, in the States, I don't think there's any problem because they are there are a lot of Latin American genetic counselors in the States that provide genetic counseling, but they know they have to be bilingual, to be accepted by the patients and the healthcare staff. They have to be bilingual. We do have also interpreters, because sometimes there are dialects that we don't know and you have to be approachable. The communication is key. So you have to know perfect English to be able to talk to the patients from the United States. And if you are Hispanic or Indian, you speak to those patients in your own language. That, I think that's what I understood about the question. I don't know if that's what they wanted to hear.
It was a bit like that.
But it's different, the political aspects of the States is different, and the hospital, we accept everybody and we don't do any discrimination, not at all. And that's wonderful. A key.
So having graduated in genetic counseling in the States, you have...
Sorry, I can add a little bit to that.
Oh, yes, please do add.
Because I think one barrier that I faced when I applied was not by being from Latin America per se, but was because of access to opportunities. So as the field is really competitive in the States, they are looking for the people that are most prepared. And as Sônia mentioned, they have a personality they are looking for that sometimes is not what we are in our country. It's not the opportunities that we had. And I had to try to equiparate with the experience people had here to be at the same level. And we will never be at the same level. And I think that's the biggest barrier that I saw. They are not, there's not this, how to say, this prejudice against where we come from, but there's this judgment of our preparation and not taking into account that we all are in different steps in our life with different experiences. Here in Canada, I see that my own experience is really valued. The things I shared, because I bring a different reality, a different experience that we had, and people are very, very open and receptive to discuss that. I find that a very healthy environment to be in. But after you are in, there's this leap we need to fight against.
So just a quick question. Do you plan on staying in Canada or in North America, or after graduating you intend to come back to Brazil or somewhere in South America?
I hope I find words to pay my debts first.
Fair.
Because no way I can pay a debt in dollar, receiving in Brazilian reais. No. But jokes aside, 2 years is not enough to learn not everything, but half of the things for to be a practicing genetic counselor. I think I have so much to learn with my colleagues and working in the field. So we really hope to get more of that experience. Always trying to make my link back to Brazil. So whenever I can participate or give back in this type of events with Splahan. But yes, that I always think about how I can better share all the things I'm learning. But I think first I need to learn. I need to become the professional I want, so I can give that back. And I expect to be in the time in my life that Sônia is now, with all the experience she has and all the things she has done in Chile and is doing with Splahan. For sure.
Yeah, we hope you do come back to South America. We need, and actually most of the genetic counselors that started programs in Europe and in Asia, they went to the States or to the programs in Australia, and they went back to their country and they started their own programs in their country. And now they have like hundreds of genetic counselors in India and Malaysia and Philippines. So we're hoping that Isabella comes back to Brazil and she can start her program. And we're going to be 2 genetic counselors, but we need more genetic counselors trained in a master's degree program. And actually, it's true what Isabella says, that once you finish, it's good to be working in different areas. Hospital work is like you learn a lot on the job.
Yes. Now let's pivot a little bit. In the chat, there's a very interesting question. In Brazil, there is an ongoing discussion about genetic counseling being provided by professionals other than medical geneticists. How do you view this debate, especially in light of your experiences? That's for both of you, by the way.
Mm-hmm. What is the question again? I didn't hear.
It's here in Brazil, the medical professionals in genetics have a very difficult time letting other professionals that are not doctors in medicine doctors, work in their areas. So genetic counseling being provided by other professionals like biologists, biomedics, nurses. There's a lot of resistance to that. So what's your perspective about it?
Well, that's a very good question, because that's a barrier that we are having here in Chile, which is they take the undergraduate title as the most important one. So if you are a doctor, a nurse, a midwife, then you do like a course or a diplomate certificate course. You are a genetic counselor. Now, I don't think that's the case, because it's not enough to be a genetic counselor to do just a diplomate course. And also, I think that biochemistry, technologists, researchers, other professionals can take this diplomate course and do the genetic counselor, because they're doing it. They are already providing genetic testing, but they're only doing that part of genetic counseling. So if they take that here, they say those biochemistry, those molecular biologists that take these training courses, they're not allowed to see patients. And I think that's very unfair, because they are doing the interpretation of the testing. They are doing projects that allow some of the patients that don't have the resources to pay these testing, and they're telling them that they cannot provide genetic counseling to do that testing. So we have those both things, people that say they're genetic counselors because they're midwives, nurses, or doctors, and they are genetic counselors. And then we have all these other professionals that take the training, the basic training, and they are not allowed to see the patients. So that's another reason that we need to do just a course, to have a consensus, to be, have something that it's equitable for everybody, that you have to have these certification, these minimum requirements to be able to provide. And it doesn't matter if you are a biochemistry, a research and molecular biologist, a nurse, a midwife, a doctor.
Okay. Back to Isabella, what do you think?
If I can also share what I see here, how it is structured in a hospital, for example. In big hospitals, what we have are full teams of genetic counselors working together with doctors and nutritionists and other professionals. So the profession is very well recognized in attending the needs of the patient. And when we see how we can share our responsibilities, because right now all the clinical responsibility in Brazil is mainly focused in the doctor, and they have a lot to do with patients, and they have a lot to learn, and they don't have enough time to do all of that. Focus in the diagnostic process, in the support of the patient, support of the family, and all of the patient relationships. So if we hear what the framework is for example, you see a cardiologist, and the cardiologist is suspecting of a genetic condition, but he doesn't have the knowledge of genetic. He can link the patient to a genetic counselor who he trusts and say, okay, you see them. They will offer the testing, and then we can come back. Or so that we are linked to those professionals to thinking about offering the best service to the patients we see. And yeah, we work together. I think that's really nice. We need the job of the physicians we work with. The physicians also ask for our help and assessment to the patients, as we can give a different type of support. They can, and I think that works really well.
I think the professional, the medical geneticist, where the profession is stabilized, the medical geneticists or the physicians in different specialties, they are more focused in the biomedics, in the diagnostics, in the treatment, the prescriptions. And the genetic counselors complement that because they are more focused in the psychosocial, the communications, the family dynamics, and also, the to answer, like Isabella says, the questions, the things that, daily things that they need to recover. And we are there to listen, to support, to provide feedback, to see how we can help them connecting with other families with the same problems. So it's like more of the support, the psychosocial, and the doctors are more of the biomedics. So we are allies. We are complement with one another. We don't compete. We are not doctors. We cannot take the patients from them. So that's my predicament. I always tell them that we are just supporting them. And I think they realize that they're burned because more and more testing is coming out, more difficult interpretations is with the results. And when they don't know, they just, we have to take the opportunities to help them there.
Yeah, just like we don't have to know every single medicine there is to give to the patient, they don't have to know every variant because we know them, right?
Right.
So there's another question. You mentioned, Isabella, about specific qualities they expected, a specific personality they expect from a genetic counselor. What would you say is that the general profile?
That's a very interesting question. I'm not in admission boards to be certain, and what I have perceived talking with other students. Let me think a little bit.
Sônia wants to comment a bit, what she thinks is the ideal
when I applied many years ago. When I applied, they were expecting me to not to be non-judgmental, not because of my religion. I will counsel a patient regarding my religion, Catholic, which is very few Catholics in New York City. So not prejudiced, like not to be judgmental, or you need to be open. Like if the patient decides to do something different that you recommend, or you say maybe it's better for you this option, and they say another option, you have to be open for to advocate the patients no matter what their decisions, because they're going to take, if you give them all the information about the benefits, limitations, the risks, and everything, and they understood, and they no, for me today, I'm not going to take this. They're going to make the decision that's best for them, by their values, their religions, their situation. And you have to respect that. Somebody wants to have an abortion because they have a cleft lip palate, and we can fix that with a surgery. And that's one of the situations they ask me, what would you do if the woman says, no matter what, I'm going to abort? And you have to accept their decisions. You already gave them all the information. So you have to be non-judgmental. And that in the interview, they realize what type of person you are.
Mm-hmm. And also very humble. Something I entered the field, and I'm changing a lot is because I worked with research before. For me, genetics was something based in data, was based in numbers. And now, when I had a patient, for example, when I began, that was dealing with uncertainty. So I wanted the testing, but I'm afraid of the results. For me, that was a simple problem. Okay, if I give the patient information, that would be enough to satisfy his doubts, and then he can decide if the patient will decide to do testing or not. And now what I realize is that this ambivalence or this uncertainty is not a step towards a decision. It's always there. It's part of being human. It will always be there. And we talk a lot about helping patients see uncertainty, but we also need to be well with delivering and working with uncertainty, because we don't know anything. We may study, we may come from genetics from the last 70 years, we discover a lot, but in the end, we don't know what is best for the person that is in front of us. They are the only person that can help themselves, and we are there to help they live their best life in the way we can support. And I think that they are looking for this type of people as well, that are open to that.
I see. And how do you deal with the emotional baggage of sometimes dealing with patients with very, very like serious diseases, sometimes children, sometimes a mother comes in with a third child that's positive for Duchenne or something like that. How do you deal with that like emotional baggage on a daily basis?
I think that it's easy answered by the strength they show to you, and that you are not there to solve their problems. You are not there to give solutions. You are there to support their decisions. And when you see yourself as in the same level, walking with them, you stop feeling the responsibility to fix things, because we are not there to fix things. And that's what I really love about genetic counseling, that it may be different from the perspective of
a doctor, for example, that expected to somehow fix it, right? We
Right.
just expected to listen and explain.
Exactly. And sometimes even the explanation is not something that we may think that the explanation is something the patient needs. Sometimes it's not. Sometimes is to just understand why they have those questions. The answer is one thing, but how they can get to the answer, I think, is where we are more at. And I think with what I learned, and the person I am becoming, working with people every day, is what makes me strong. And I don't see much of that baggage. I think, of course, it can affect us. The amount of work is a lot of work. But when I look back and I think who I was one year from now and who I am now, and when I talk with my colleagues and see where they are at, and I see, oh I really want to be that. I want to be there. That makes me want to grow and continue in the process.
But you,
Yeah,
Professor Margaret,
you
have
grow.
a lot more experience than us. Yes.
Yeah, you grow, and actually you remember the most emotional cases all the time, and you learn from them. As a genetic counselor, you learn that they only want to be listened to, and they want to be having someone that they can talk and just ventilate their feelings, their worries, their guilt, their uncertainty, and you are there to support them. And one of the things Isabella says, you are not there to fix and give a solution. You can provide options. You can say, like provide anything that alternatives maybe, but if they just want to talk. And that's one of the things, the privilege that we as genetic counselors have, that we have the time to listen, which the doctors do not have, and to listen to their doubts, to listen to their uncertainties, and to listen to maybe they're saying something that's ridiculous, or I wish I didn't want this baby, and look, but it's not that they don't love their child, but all that guilt. So that it gives them a space. And as genetic counselors, sometimes we are burned out. When I was working in New York City, I saw sometimes 10 patients per day. And so we have our colleagues to ventilate ourselves, because you can get burned out. And what I have here, I work with 3 geneticists. So we have our meetings. So you always is good to work in a team where they can understand your problems dealing with patients, and not, because we as human beings want to help. And that's one of our flaws. We want to help them. And sometimes there's no way you can't. That's the thing there is. And I think we need to learn that being there for them, it's a good help.
Yes, indeed. I had a few, I didn't have patients myself, but I had a few experiences during my internships that I do remember to this day. Like there are a few that kind of left my mind, but there are a few that I remember like 2 years ago, 1 year ago, they stay in my head, like really moments that mark us, right? Specific patients that you talk to sometimes, they tell their story. You see sometimes a family that the whole family has the same disease, and you see sometimes an adult seeing their older mother, their older father suffering the same thing they will suffer from in a few years. It's really something that affects us a lot.
And you have patients that inspire you. You have patients that have
truly.
sometimes a diagnostic that they're going to die, and they tell you, well, I lived all my life. I enjoyed my life. You know, this is the time. I don't want to go to that treatment. It's not going to help me. So I'm happy how, and so those are the patients that you remember. It's going to problem, just the thing. So it's a learning experience to see that life is more about just little things that you make a big deal about it, and you learn about those things that really value. So she says, I see the birds, I see the nature, I appreciate my son. So that's life. And she accepted her diagnostic. And of course she went over, you know, the whole thing of the sadness when she got the diagnostic, but afterwards she wanted to know about the family, and she was over it. She said, I'm just going to live the days that I have left the best that I can.
Indeed. And one thing I like about being in this career is that we always get the good news first, like the new Huntington treatment that's going on. Like we always have this good news about.
That's right.
Oh, I remember that patient that I saw that had this. Oh, they were going to be so happy about this new treatment, this new clinical trials that are going on. It's something that I enjoy about being in this area, because you always know about the good stuff first.
No, and actually that can give to other health, you know, neurodegenerative diseases another light. Oh, look, it happened with this. Why not in 10 more years? So it gives them the light. Maybe it's not going to happen right now, but they're for them. Hope. It's like there's hope. Yeah.
And so now, final question, just to give us a nice laptop. What advice do both of you give to Brazilian students who dream of working abroad, whether in North America or in other countries in South America, or even in Europe, if you know about the
Isabella?
For me, the first is networking. So know people that are working there. What I discovered with this field especially is people are very welcoming to talk. And everybody that I reach by email that work in the States, I even had an opportunity that someone said to me, "Oh, come here to see me work." But for bureaucratic reasons with the hospital, it was not possible. But people are open to showing this word, or a 30-minute talk by Zoom, or even changing email. It's important to realize how things are different, or how they are differently practiced in other fields, to see if in other countries, to see if that's what you were looking for, and how you can better prepare to insert yourself in those fields. And it's a gradual process. I think there's no easy path, and sometimes is the most unexpected things happen. Like when we are open to opportunities and looking, sometimes things seems to like just reach to us.
Doors happen to open right in front of you.
Yeah, but it's because you are knocking in all those doors and you don't realize, okay, one open. So yeah, knocking all those doors, and there may be experiences that can bump you down, or interaction that you may. I felt is my place here. Sometimes I couldn't identify with the field here or the people that practice here, but then I found Splahen. I found a community that support me and help me grow. And I think we need all to find these little mentors and opportunities, because it's hard, but I think if we fight hard enough, we can get where we want.
Yeah, I do.
Professor?
I agree with Isabella. If you have passion and you really like genetics and helping people, and you're not willing to be a doctor or medical, but you really want to find out, just keep knocking doors. I would suggest going to the meetings, to the conferences. You meet a lot of people there. Talk to those people. They're not going to put any face, just if you are. And then I know some of the programs in the States have mentorship for students that are overseas, to see how they can take the programs being overseas. There are some programs that the first year is online, and then the second year, where you have to do your clinical practice, they find a way that you can do it, and concentrate that. Voice program, I don't remember, it's in Minnesota, I think. There are two programs that it's online. They have that hybrid way that you can take. It's 2 years. So if I was in your position, I would go for students that want to, get a master's degree and not wait till it gets credit in South America. Find out about the programs that are available in Canada, in the States. Go to the conference where there's geneticists, and they talk about genetic counseling like here, and find out how can you apply being overseas, because you're not going to be the first one. There are a lot of genetic counselors globally that have been trained in these programs that are already credentialed. So it's a wonderful. I have been a pioneer here in Chile. I have been some downs and some challenges, but it's a really rewarding profession. If you have people that support you, there's always welcoming. In South America, we need more professionals. So I really encourage people that have a passionate for this to keep going. Look at Isabella. She approached me, I think, in Hugo. That's when I met her, and look at where she is now.
Very well, very well. Well, thank you both for accepting our invitations. This was a wonderful, wonderful discussion. People can't stop praising you all for the discussion. They think it was a wonderful ending to a wonderful conference. So thank you again. And now we go to Caroline, who will talk about our gifts, our sorteio.
Okay.
I forgot the word. Just again, thank you both, and let's say goodbye.
Thank you. Bye.